Today, we are going to talk about when to see a specialist when you are trying to conceive. A woman that is less than 35 years has been trying to conceive for like 12 months. In this case, we mean having regular, unprotected sexual intercourse for 12 months and nothing happens. It is time to see your gynecologist. If the woman is 35 years and above, 6 months is enough time for you to see a gynecologist if there is no conception. The reason is this: for the woman that is 35 years and above, the egg quality is beginning to decline. So waiting for another 6 months will further decline egg quality and the age. For women under 35 years, 12 months of regular trying, regular sexual intercourse, unprotected, is what we ascribe, what we subscribe to. The reason is simply this: it is expected that every couple should be able to conceive naturally. But we all know that not everybody will conceive the first month or the second month. Human reproduction is highly ineffective. For every month of trying, the chances of pregnancy occurring is only 20%. That is how God made it. That's how nature plays it out. We are not like animals. When the animal is on heat, you are certain that when the animal mates, pregnancy occurs. But for humans, in order to avoid overpopulation, it is 20%. So if it doesn't happen the first month, it will happen the second month or the third month or the fourth month. If you bring 100 couples trying to conceive, 80% of those couples will conceive at the end of 12 months. So the remaining 20% will probably wait for evaluation before something happens. After 12 months of trying, the only reason for you to see a gynecologist is if you don't miss your period after them. You may look clinically okay, no problems. Your partner or husband can also look okay, no problems. But we are not seeing any pregnancy. So that is the time for you to see your gynecologist. Then there will be proper evaluation by way of medical history and examination. Then investigations will also follow. With all these investigations, if there's anything that is detected to not be addressed, it may be hormonal problems, it may be damaged fallopian tubes, it may be low sperm count. So these are the things that we look out for. If there are problems with that, then there are medications that can be given to make things better. Then while you are on treatment, we still encourage you to keep on meeting, having sexual intercourse, and hoping that pregnancy will occur during that time. For women that see blood during pregnancy, it is not described as period in this case. Some women see spots. Period means it is regular, the volume is significant, it keeps on coming at a particular time. There is an entity in gynecology and obstetrics called early pregnancy bleeding. So it is not unusual for certain women to see blood even when they are pregnant. The important thing is that you should have a doctor that you are seeing. They will continue to evaluate you, because the first 3 months, things like that can happen in some people. So further evaluation will determine whether the baby is okay or not. If the baby is okay, pregnancy continues. At a point in time during the pregnancy, the bleeding will stop on its own. So it's not really period per se. It may just be bleeds that can happen, and it can be as a result of a lot of things. So may not be a problem as long as the doctor reassures you that the baby is growing and the baby is fine. The bleeding is expected to stop at a particular time. Male-related signs of infertility. Sometimes you may have a situation where, you have the scrotum, the testis is smaller than it should be. That may be a problem. In some cases, you may only feel one testis and don't feel the other. Probably it has not descended, or for whatever reason. You may also feel that. And you have been in a relationship and trying to get pregnant for up to like 12 months and there is no pregnancy. Like we know, it takes two to tango. It's not only a woman's problem, the man also needs to have a role to play in this. So there are really no signs, serious signs per se. So you just have to visit your doctor with your wife and get evaluated. In some cases, the woman may not have any problem and it may be a male factor situation, or the other way around, or a combined situation. The man has problems and the woman has problems. So we'll just treat alongside and see how we can optimize things for pregnancy to occur. So it is always advisable for our patients to see the gynecologist as early as possible. In this case, 12 months for a couple that the female partner is 35 years and below, and 6 months for the couple that has a female partner that is more than 35 years. We'll be stopping here for today till another time. Don't forget to subscribe and also turn on your notification button so that you can get our next video as soon as it's published.